Hi guys, welcome back to my channel Med Made Simply Easy. In this video, we're going to see about febrile seizures. So it is defined as seizures associated with fever more than 38 degrees Celsius occurring in neurologically healthy children between 6 months and 5 years without any underlying intracranial infection or any prior unprovoked seizures. So febrile seizures, they are common neurological disorder in children, and it occurs in 3 to 5% of children below 5 years. And 20 to 40% of the cases usually have positive family history. It is usually due to an extracranial source such as upper respiratory tract infection, gastroenteritis, viral exanthem, bacterial infection, ASOM, dysentery, malaria, or immunization. Febrile seizures must be differentiated from acute symptomatic seizures due to an intracranial infection, seizure triggered by fever in children with underlying epilepsy. Pathogenesis. Exact mechanism is not known, and it may be an age-dependent phenomenon, and it could be due to a response of immature brain to febrile illness. Classification. So febrile seizures are classified into simple and complex. So this in simple, it is of a generalized seizure type and it lasts less than 15 minutes and it occurs only once within 24 hours. And there is no post-ictal neurological abnormality. In complex febrile seizures, it is of focal seizure type and it is usually more than 15 minutes. And it is characterized by recurrent seizures within the same febrile illness. And it is associated with post-ictal neurological abnormality. Recurrence. 1/3 patients have recurrent febrile seizures, 1/6 patients have multiple febrile seizures. The risk factors for recurrence are age less than 18 months, family history of febrile seizures, multiple seizures in the first episode, seizure at low temperatures, and if the patient is a male, and if the patient has hyponatremia. Investigations. For complete febrile seizure, lumbar puncture, EEG and neuroimaging is done. For simple febrile seizure, usually no investigations are required. Now, and to find out the cause of fever, hemogram, CBC, ESR, blood and urine culture, and serology can be done. Indications for lumbar puncture. Age less than 6 months, toxic and ill-appearing child, any clinical suspicion of intracranial infection, age 6 to 12 months, if HIB2 and pneumococcal vaccination is not done, or if the immunization status is unknown. So and this is a relative indication. Risk factors for future epilepsy. If there is a pre-existing neurodevelopmental abnormality, complex febrile seizures, and family history of epilepsy. Management. In children with active seizures, IV or rectal diazepam is the first choice. If intubation is available, IV or nasal midazolam 0.1 to 0.2 mg per kg is prescribed. Antipyretics and drug prophylaxis reduces but does not completely prevent the reoccurrence or development of seizure disorder in the future. The drug of choice for febrile seizures is valproate 15 mg per kg initial dose and maximum dose is 60 mg per kg. Prophylaxis. In children with risk factors for recurrence or those with frequent recurrences, the criteria for frequent recurrence is more than 3 episodes in 6 months or more than 4 episodes in 1 year. So the drug prophylaxis for febrile seizures are oral benzodiazepines started at the first sign of fever and continued for the first 48 hours. Thanks for watching and subscribe for more such videos. Check the Pediatrics playlist for other videos and let me know your suggestions in the comment box below.